Welcome to the first of our fall series called The Intersections of Neurology and Celiac Disease, hosted by the Celiac Research Program at Harvard Medical School and the National Celiac Association. I'm Lee Graham, Executive Director of the National Celiac Association, serving the gluten-free community since 1993. The launch of our Feeding Gluten-Free initiative in response to the need at food pantries has been tremendous. Up to now, we've shipped over $800,000 worth of gluten-free food to food pantries in 31 states. Even while serving over 250,000 children and adults, the need continues. Food pantries tell us that the demand is 2 to 3 times more for gluten-free families than ever before. And we've heard stories about moms and dads skipping meals so their kids with celiac disease can eat gluten-free. Despite the food we continue to deliver, there are so many more families we need to help. Please consider a generous donation to this important program at nationalceliac.org. Thank you. For today, you are welcome to ask general questions through the Q&A feature, which is located on the right-hand corner of your Zoom screen. If you're still struggling to connect with us, tech support is available if needed at digitalmedia@partners.org or phone 857-282-6470. Also, this session is being recorded and will be available for viewing on NCA's website, nationalceliac.org, probably in a week. I'm honored to introduce today's moderator, Dr. Alan Leichner. Alan is founder of the Celiac Kids Connection and the director of the Celiac Disease Program at Boston Children's Hospital. He also serves as Chief Education Officer and Director of the Department of Medical Education at Boston Children's. He is the founder of the Boston Children's Hospital Academy for Teaching and Educational Innovation and Scholarship. Dr. Leichner is a professor of pediatrics at Harvard Medical School. He received his undergraduate degree from Brandeis University and his MD from Harvard Medical School. He completed his pediatric residency and his fellowship in gastroenterology at Boston Children's Hospital. He also has a Master's of Science in Health Professions Education from the Massachusetts General Hospital Institute for Health Professions. As the former Associate Chief of the Division of Gastrology, Hepatology, and Nutrition at Boston Children's, Dr. Leichner expanded the clinical practice to include multiple centers and subspecialty programs, as well as satellite offices. Dr. Leichner is the author of dozens of scholarly articles and has been recognized locally and nationally for his clinical and educational leadership. On top of that, I can tell you from experience that he is a brilliant, warm, caring, and nurturing physician. Welcome, Dr. Leichner.
Thanks very much, Lee. My favorite part of that introduction was the last part. Thank you. I want to not only thank you, but Kim and the other NCA staff for all you do for patients and families who are affected by celiac disease. It's a true pleasure to partner with you and the Harvard Medical School Celiac Research Program. And I'm very excited about our topic today, which is the intersection of neurology and celiac disease. I have also a couple of logistical points to cover. First is that we will try, but I'm not sure we'll get to answer all of your questions. For registered dietitians, there will be 1.25 CEUs available. So now we'll get right to the program, and it's my pleasure to introduce our first speaker, Dr. Samuel A. Frank. Dr. Frank is the director of the Huntington's Disease Society of America Center for Excellence at Beth Israel Deaconess Medical Center. And he's also an associate professor of neurology at Harvard Medical School. He completed his fellowship in experimental therapeutics and used that to have a focus on movement disorders. Dr. Frank directs research and leads clinical trials as part of the BIDMC's Parkinson's Disease and Movement Disorders Center. His goal is to develop treatments to improve the lives of patients with Parkinson's disease by improving symptoms and treating the underlying disease of gluten-related disorders. Dr. Frank recently joined the Celiac Disease Center at the BIDMC to bring his expertise to patients with celiac disease who struggle with ataxia and other coordination problems, neuropathy or nerve damage, migraine headaches, and other related neurological symptoms. Dr. Frank has two wonderful daughters and other family members who have celiac disease. And I will ask Dr. Frank now to share his slides and start his talk. Thank you.
Great. Well, thank you so much for having me. And it's really a pleasure to be here and to talk about so many topics that are close to what I do professionally and are close to my heart personally as well. In terms of disclosures, I don't have any direct personal payments from pharmaceutical companies with FDA-approved products for any of the diseases I'm going to be discussing. I do a fair amount of human subjects-based research, and this is mostly funded by a variety of foundations and industry partners, and I do receive some consulting fees. There's so much to cover in neurology, and I'm not going to be able to cover everything. I'm certainly not going to be able to cover it in detail, but I want to give an overview of many of the common topics that come up when we think about the intersection between neurology and celiac disease in adults. I think overwhelmingly there are questions and comments about brain fog and the cognitive aspects of celiac disease. So I want to touch on dementia as well. Neuropathy was one of the earliest intersections that was described, so I'm going to be touching on that as well. Migraine comes up very frequently. It's frequently talked about, that celiac disease is frequently talked about in the context of epilepsy or seizures. And in my world, in terms of movement disorders, I started learning about celiac disease in the late 1990s during my training when I was focused more on movement disorders and ataxias. I'm going to touch a little bit on non-celiac gluten sensitivity and some of the neurologic issues that have been described there. And almost always there are other neurologic conditions that are brought up in the context of celiac disease. And so I just want to highlight the lack of links to some of those other neurologic disorders. I want to start off with a case just to kind of ground us and give you some examples of some cases that are referred to neurology. These are based on some patients that were actually referred. So the first one is a 24-year-old female, 2 years of right-sided throbbing headaches that are associated with nausea and occasional vomiting, no family history of migraines. Now that first bullet point there is very typical for a migraine type headache. Very often migraines run in families. They don't always, but very often they do. And routine blood tests in this woman were normal. Imaging was negative, was normal, but there was an elevated test for celiac disease, the tissue transglutaminase IgA. And so someone like this, we might go through the full evaluation for celiac disease. And in her case, after 6 months of being on a gluten-free diet, her headaches were dramatically reduced in frequency and severity. So there was a clear response. Here's another woman that came to see me, a 62-year-old with 5 years of progressively worsening memory issues and tremor with writing when she was holding her drinks and when she was putting on makeup, for example. It was clear that her mother also had tremors and she had an elevated TTG-IgA on screening. Now, I bring this up because her celiac disease was not related to her tremors. They were completely separate. She has familial tremor, which is very common, and happened to have been diagnosed with celiac disease also. So I just want to emphasize that there is an overlap sometimes with common disorders, but often no causation is necessarily found. This third case is not mine. This was a case that was published in the literature in 2007. This is a 30-year-old male who had 2 years of headaches and difficult to control seizures, as well as some right-sided weakness. The routine blood tests were unrevealing, and during chronic constipation and rash, a celiac disease workup was initiated, and TTG and other markers were all markedly elevated. A small bowel biopsy at the time was diagnostic of celiac disease, and the skin biopsy was consistent with what we typically see in the skin, dermatitis herpetiformis. Now, rarely, this is very rarely, we can actually see some issues on imaging, and I hope you can see in the MRI, in this case, that there were some lesions that were in the brain that were found. Now, this case, a gluten-free diet was initiated, and 2 years after that, he was seizure-free, continued to have some right-sided weakness, and there were some mild cognitive difficulties. But I hope you can also see that even in this severe, rare case where we saw changes in the brain, on a gluten-free diet, the lesions resolved. So I think that this emphasizes that even in more severe cases, with strict adherence to a gluten-free diet, we can improve symptoms and other measures that we can take a look in celiac disease. Neurology and celiac disease is not a new concept in terms of the overlap, and about 10% of patients with celiac disease actually present with neurologic symptoms. So it's relatively common in terms of one of the first symptoms to present. It's also been reported for well over 100 years, and the first report was in 1908 by Carnegie Brown, who mentioned peripheral neuritis in 2 patients. So this is peripheral neuropathy or inflammation of the nerves in the arms or legs, and I'll tell you a little bit more about peripheral neuropathy. There are a number of reported neurological manifestations in celiac disease. Some are more common that I've talked about, and we're going to be talking about these in more detail. I'm not going to be talking about depression and or anxiety. I know that there are other sessions that have addressed this specifically, but I'm not going to be talking about this specifically today in the context of neurology. I also want to highlight that restless leg syndrome can be secondary and related to peripheral neuropathy. So these are the issues that I'm going to be talking about in terms of the more common. There's a long list of less common, even rare manifestations of celiac disease and the overlap with neurology. I'm not really going to be talking about these. These are single case reports or a handful of people when we're talking about the millions of people that might have neurologic issues and the handful that have an overlap. So I'm not really going to go into those, but I just wanted to be sure and mention them. Right off the bat, I want to address brain fog because it does come up so frequently. Just to be clear, it's not a medical term, but it's a term used to describe many symptoms that people pinpoint that may interfere with their thinking. And when you go into a bit more detail about what people are referring to in terms of brain fog, talking about poor focus, word finding difficulties, organization difficulties. There's often a sense that the memory is not right in some way. And rarely it can lead to occasional episodes of confusion or disorientation. And we don't really know what this is from, but there are some possible mechanisms. Nutritional deficiencies is a theme that you'll hear from across other neurological manifestations of celiac disease. There's also the possibility that there's some regional cerebral hypoperfusion or less blood flow in the surface of the brain than there should be. And that could be because of inflammatory response that is a reaction to untreated celiac disease. And so there's low level markers of inflammation that could be influencing the surface of the brain. And this may also influence some of the neurotransmitters that may have an impact on sleep, mood, and thinking, including serotonin. In untreated celiac disease, the association of inflammation may interfere not only with inflammation, but with neurotransmitters that can secondarily also impact some of the vasculature in and around the brain. I should emphasize, and I'm going to say this throughout, that most of the complications are related to untreated celiac disease. How do we treat brain fog? It's really the gluten-free diet. And this is a quote from one of the papers. Cognitive and mood improvement was shown to occur only after a long-term gluten-free diet. So this is not an improvement that you're going to see overnight, over perhaps not even within a few weeks or a few months. This can take a lot longer, particularly if this is more severe. And I also want to be clear that brain fog is not dementia. These are two different processes, and brain fog does not lead to dementia either. That being said, it's not well studied, and I have 3 papers up here listing what's been done in terms of brain fog and celiac disease specifically. There's a lot more that's been done in terms of the cognitive aspect, but brain fog specifically is pretty limited. So just to touch on dementia, again, dementia is very common in the United States, and there really is questionable association between untreated celiac disease and dementia. This is one case report. There were 26 cases of dementia or cognitive impairment that were reported in the context of celiac disease, and really there were significant GI symptoms at the time, and relatively speaking, acute onset of dementia. So when we think of dementia like Alzheimer's disease, it starts and it gradually gets worse over years, sometimes a decade. So if people have cognitive issues that come on suddenly and there's a crash course and there's GI issues, that's a situation to think about a cause of dementia that is not just the usual Alzheimer's. And that's what was seen in these cases. Again, the mechanism was unclear, but it could be because of deficiencies of folate, vitamin B12, or vitamin E. And these all have been identified in these cases and are known to cause cognitive issues, not just in the context of celiac disease, but outside of that as well. And treated celiac disease is less of a concern in terms of deficiencies. Of the 26 cases that were studied, 13 were followed over time, 3 stabilized, and 2 dramatically improved on a gluten-free diet. So again, that is the treatment for this. Getting into neuropathy. So the definition that I usually use is nerve injury or irritation that results in numbness, tingling, pain, or weakness. We often don't find a cause for a neuropathy. Some of the more common causes can be diabetes or alcohol abuse disorders. There are nutritional deficiencies as well. But many times we don't find a cause of neuropathy. And in one study, they looked at all causes that they didn't really find out the cause and specifically looked for celiac disease. And it turns out that 8% had celiac disease. So it is a relatively common cause of neuropathy. EMG stands for electromyography, and that is the main test that we use to diagnose and track neuropathies. And these are either normal or mildly abnormal, which is not uncommon. Nerve biopsies have been done in a few patients, and this showed mild to anywhere from mild to severe axonopathy. So nerves have a wire and an insulation, and it can either be the wire or the insulation that's impacted. In these 3 cases where there was a nerve biopsy, it was the wire. That's what the axon is. And 65% of patients who were found to have celiac disease in this clinic with neuropathy had some form of reactive antibodies. So there was a clear inflammatory autoimmune process that could be measured. There's still a lot of debate, however, if neuropathy and celiac disease is due to malabsorption or to celiac disease itself. Moving on to headaches. This is not well studied. There are some studies, and I know we're going to hear about this more later in children, but in patients with celiac disease in one series, just about a third reported headaches. In another, on the flip side, looking at patients with migraine, celiac disease was found in just over 4% compared to 0.4% in blood donors in the same era. So it was significantly higher in those with migraines. And headache, whether it's migraine or other types of headaches such as tension, are definitely more common in celiac disease patients compared with controls. What can we do about it? Gluten-free diet. This is a theme. So when we look at the the response to headache, and this is prevalence and response to a gluten-free diet in neuropsychiatric manifestations of celiac disease in a paper from 2019. When you look specifically at headaches, there was an improvement in about 3/4 of patients. So that there is something that we can do for headache. Moving on to ataxia. Ataxia is a lack of accuracy or coordination of movement. And this is not because of weakness. This isn't because of tone. This isn't because of our position sense or the presence of involuntary movements. And I want to show you a video to highlight ataxia. This is a patient who does not have, he's subsequently passed away. He does not have celiac disease, but he has another form of
totally
ataxia.
able to function
Until
with fine control movements in dental surgery
until you had
until
your
I
pneumonia
stopped
in
in March.
2006.
with that acute episode of infection.
Okay. Let me have you take your glasses off.
So I hope you heard in his speech that there was a little bit of slurring. In fact, he's a dentist, was a dentist, and was accused of practicing while drunk, and he was not. So you can see as he's going back and forth between his nose and my finger on the right side, he's kind of taking the scenic path, and he takes an even more scenic path on the left side. So this is not even on both sides. And he has difficulty with rapid alternating movements as well. So this is pretty classic ataxia. You can also see with his walking that he walks with his legs a little bit stiffer. His feet are far apart, and this is classic in ataxia to help with their balance so that they are a little wider apart than they are normally. Ataxia associated with celiac disease was first reported in 1966, so this is not a new phenomenon. This was in 16 patients. And some patients with ataxia, again, it's due to malabsorption syndrome. We know that low vitamin E can cause a similar picture. And when we look at tissue transglutaminase, there are very few studies. An older blood test that we use in addition is anti-gliadin antibodies. And on average, these are higher than other people without celiac disease and up to 41%. We don't really know the cause, again, in patients with cerebellar ataxia with unknown cause, celiac disease was actually found in 1 out of 6 patients, 16%. And we don't really know exactly why people get ataxia beyond malabsorption. There have been antibodies that have been found in some brain cells, and specifically the cells that cause, that help out with coordination are the Purkinje cells, and also near blood vessels. I know I'm covering a lot of material. Bear with me. In terms of epilepsy, a recurrent seizure disorder, in 108 consecutive patients with otherwise unexplained epilepsy, 3.7% had celiac disease. So it can be a cause, it can be associated, but it's not very common. When we look at all studies, the range of prevalence of celiac disease in patients with epilepsy was anywhere from 0.7 to 2.5%, so right in that range. But in every case, it was more than in control populations. So in people without epilepsy, in other words. And so there may be some connection between otherwise unexplained epilepsy and celiac disease, but I think that there's not clear evidence at this time. There is, however, a rare syndrome that runs in some families of epilepsy and occipital calcifications, or in the back part of the brain where the vision part is, there's extra calcium that forms. And this is in certain families that have been described in Italy, Spain, and Argentina. So that's pretty rare, but there is that clear association in that one set of families. Epilepsy and celiac disease in terms of treatment, in more than 50% of patients with epilepsy and celiac disease, they'll respond positively to a gluten-free diet. And anything to reduce the frequency and severity of seizures is very much appreciated. And that's what was seen. A decreased frequency, seizures were easier to stop, and there was less medications that were needed. So why did we see this? One may be a resolution or reduction in the primary neurological issue. The second may be improved absorption of the anti-seizure medications. Absorption of medications is a huge issue when it comes to epilepsy. And if you're able to absorb the medications better, that can get into the brain and perhaps stop the seizures. So again, a gluten-free diet really can reverse many of the neurologic issues that we find. These are some of the disorders that I hear about and get asked about fairly often. Is there a link to other neurological disorders? If I have Parkinson's disease and celiac disease, are they connected? Multiple sclerosis, since it's another autoimmune disease. Huntington's disease is a rare genetic disorder that I deal with, and there have been some abnormalities found with tissue transglutaminase. There are other primary brain disorders that people ask about, but I think most of the time we do not find a connection between the two. Just to give you an idea, that first example of the 62-year-old with tremor, essential tremor or familial tremor, is in 10 million Americans. With such a common disorder, we're gonna run into an overlap between celiac disease and other common neurological disorders. There's 6 million Americans with Alzheimer's, 1.5 million with Parkinson's. Cervical dystonia is the other CD that I use in some of my talks. It's considered a relatively rare neurologic disorder that we treat with botulinum neurotoxin injections. And there are about 50,000 people that have that disorder. There's no connection between dystonia and cervical dystonia. Excuse me, and celiac disease.
5 minutes, Dr. Frank. Thank you.
Thank you. So we look at tissue transglutaminase as one of the markers. We're looking at it in other neurologic disorders as one of the measures. Is there an overlap? But so far, we really don't see much of an overlap between some other primary disorders beyond what I've mentioned. Non-celiac gluten sensitivity is a syndrome characterized by a cohort of symptoms related to the ingestion of gluten-containing foods in people who are not affected by celiac disease or a wheat allergy. And they can experience some similar neurologic symptoms. That includes foggy mind. I think that's really kind of the same thing as brain fog, headache, fatigue, joint and muscle pain, and neuropathy or leg and arm numbness. And so this has been well described. And there may be an association with other neurologic issues that I've touched upon, including ataxia, neuropathy, cognitive impact, and psychiatric diseases such as depression, anxiety, and in one rare case, psychosis. So there may be another connection as well, not just to celiac disease and neurology, but non-celiac gluten sensitivity and neurology related issues as well. What are the consequences of non-compliance? Because whenever I talk about the neurologic manifestations, I hope you've heard my message that gluten-free diets can very much improve neurologic symptoms and improve the issues. But if there is not compliance with a gluten-free diet, if you're not able or willing to get gluten out of your diet, there can be continuation of the issues and it can progress. And this is a situation where other autoimmune disorders may increase in terms of your risk of getting those the longer that you have untreated celiac disease. And so this includes cerebellar ataxia, epilepsy, and some of the other disorders that I've talked about. I think that neurologic manifestations of celiac disease is proven in some cases, a gut feeling in others. I think that there's an overlap, and I think that the more that we're able to study this and put them together, the more that we can see that there may be a connection, but there certainly is improvement when people are on gluten-free diets for a variety of reasons, including better absorption of nutrients and medications. Just in terms of my takeaway tips, neurologic manifestations in celiac disease are common, but not commonly serious or severe. And while there may be many possible neurologic manifestations in untreated celiac disease, most symptoms can be improved or reversed with strict adherence to the gluten-free diet. And so I'm going to finish. I know I'll stick around for questions as well, but I'm going to finish with a picture of one of my two daughters with celiac disease. I have 3 daughters, and this is my daughter who you can see has stitches on her forehead. When she was 3, she was doing what 3-year-olds do, dance, tripped, and fell and unfortunately hit her head and required stitches. Was this ataxia? This was right as she was diagnosed with celiac disease. What I can tell you is that she is a thriving 19-year-old now. So is my other daughter. So they're doing great on a gluten-free diet and feeling quite well. So thank you for your time and attention, and I look forward to your questions.
I'd like to thank Dr. Frank. That was a terrific talk, really, really clear, and I think it hit all the issues that were regarding neurology symptoms in adults. We are going to handle all your questions after both talks are finished. And we're going to change perspective now and go to discuss childhood neurological manifestations that may be associated with celiac disease. It's my pleasure to introduce one of my pediatric gastroenterology colleagues, Dr. Benny Kersner. He's a board-certified pediatric gastroenterologist. I should be able to pronounce that term since I am one, with more than 30 years of experience, both in terms of medical practice, but also basic and clinical research relevant to our field. He established the Division of Gastroenterology, Hepatology, and Nutrition at Children's National Health System and is a major figure nationally in pediatric gastroenterology. Locally in Washington, he's been listed as one of Washingtonian's magazine's top doctors since 1985. Dr. Kersner's reach is in fact global. He's traveled to South Africa to examine nutritional issues and investigate feeding disorders in children. He's been the medical director of the celiac disease program at Children's National for many years. He stepped down from that role, but remains an active member of the celiac team and celiac community. And with that, I'd like to introduce my colleague, Benny Kersner. Yes, let's bring back Dr. Frank, and we'll ask him some questions. So one of the things that challenges patients with celiac disease and brain fog is convincing people that brain fog is a real thing, especially their primary care doctors. Could you comment on that for us?
Absolutely. Just because it doesn't have an official long Latin name in the literature doesn't mean that it doesn't exist. It certainly does, and it's a real phenomenon. And you should, no matter what the symptom is, you should describe what you're experiencing to your physicians. And I think we happen to put a name on it, brain fog, and it very much is a real phenomenon that patients experience in celiac disease in particular, but it's not the only disease where people can experience that. And it is a set of symptoms. So if there's something specific that you can put your finger on, that might be a better way to communicate with not only your physician, but perhaps address the underlying issue above and beyond the gluten-free diet. But describing what you're experiencing should certainly be something that you should be able to communicate with your doctors.
Thank you. I have one more question for you, and then I think that Dr. Kersner will be back with us. So in somebody who's absolutely strictly following a gluten-free diet and then develops a neurological complication like you've discussed, can we say that it's related to their celiac disease?
It may be a bit difficult to sort out in that situation. And in fact, it depends how long they've been on a gluten-free diet, right? So if someone's been on a gluten-free diet for a week, probably related to celiac disease, if it was just discovered. If they've been on a gluten-free diet for 10 years and then they develop some type of issue, I think it may be worth exploring other etiologies beyond celiac disease. So in some, it depends on timing when and the onset as well. But I think that until the body fully heals from being on a gluten-free diet, it's worth having your antennae up, looking out for other complications, including neurologic manifestations.
Great, thank you. I think that will help a lot of people who are religiously following their diet and get new symptoms. Another question about brain fog. Say that you presented, your celiac disease presented with brain fog just on the gluten-free diet, and things haven't resolved yet. Is there anything else that people could do to help with brain fog?
A gluten-free diet is obviously the first and most important aspect of addressing brain fog, and it takes longer than you think. That's really what I found in terms of looking in the literature, in terms of every cognitive manifestation. It definitely takes longer, and if it continues, I think it may be worth making sure that your vitamin levels are up to speed, such as your vitamin B12 and other nutrients. In general, people don't need additional supplementation. They just need to get back on a gluten-free diet. But there are certain aspects of nutrition that can be measured and may need to be supplemented. So it's worth exploring with your doctor.
Great, thank you. We'll put a pause on the question and answers for now. I see that Dr. Kersner is back, and I'd ask him to share his screen and move forward.
I apologize for the delay. The thing just shut down on me, but let me try share my screen. Firstly, I just want to say what a privilege it is to join you all, and it really is an honor. I have in front of me a picture of my grandchildren, and anyone who's watched the development of a young brain knows that neurological issues are something we got to be awfully concerned about, and certainly within the context of celiac disease. Now, I don't have any disclosures other than to say that I am part of a multidisciplinary team, but the people who really have done the work in neurology are our neurologist Ilana Khan, Megan Sadie, a neuropsychologist, Shana Coburn, a psychologist, and I'm talking on their behalf as they couldn't be here today. And none of this would be possible if not for Vanessa, who was the heartthrob that made our multidisciplinary team function. We are also very grateful to have this team. Not only has Children's Hospital made it possible, but philanthropists, the Raber family, who conceived of the need for a multidisciplinary team, including a neurological and psychological dimension. And we could not have done this without the support of the Global Autoimmune Institute, directed by Sandy Wernes. In the course of this talk, I want to just relate to you the emergence of neurology in celiac disease for children, and also emphasize three things: headaches, the psychological dimensions, and the neuropsychological dimensions. Well, with that in mind, let me again restate that we've known about the connection between the gut and the brain in this area for a long time, since 1908. But we've only had the opportunity to sample the intestine of children with celiac disease regularly after Crosby introduced this suction biopsy. I was handed this in the early 70s and began to understand celiac disease, but had no notion of the dimensions that it covered. We now realize that there is this iceberg effect. If you have the genes, you're predisposed to the disease, and even if you develop it, only a small number actually show it clinically. The original presentation that we saw was this miserable child, unfortunate child with a bloated tummy, wasted, crying. We happily don't see these children that often, this classical presentation. We now know that with the inflammation that accompanies this disease, we can have a large variety of things: short stature, iron deficiency, etc. And strange rashes that we'll see in adults mainly, fractures. And even in children with syndromes such as Downs, we know that we must look for celiac disease. But it's interesting that when guidelines were issued originally for the diagnosis of celiac disease, neurology was not listed there as something to prompt a biopsy or prompt investigation. And even now, we've realized that autoimmune conditions would be a hint, but it's taken a long time to appreciate that headaches and neurological issues are very much part of this illness. When we started our multidisciplinary clinic, set out to investigate what we're going to find. And after we had seen about 50 cases, we got preclinic data, put that together, and you note that what the parents reported prior to their first visit were large numbers of headaches, fatigue, cognitive learning and attention issues, more so than vomiting, distension, constipation, diarrhea, and poor weight gain. So we certainly knew that emotional and neurological issues were important. If we look more closely, there was a large amount of ADHD seen, attention deficit problems, anxiety, developmental delay, learning problems. None of this was all that surprising, but we note that the soft features of neurological change, meaning not the seizures, the paralyses, the peripheral neuropathies, but the central effects are what we're going to encounter mainly in children. Lesions which don't necessarily have a focal point. We shouldn't have been surprised. In Israel in 2004, a very good survey was done. And again, you notice ADHD and headaches as a prominent feature. What about more recently? We actually now have close to 400 cases in our multidisciplinary clinic from which we gather data. These come from the first 116 that entered into an experimental group. Notice that the common thing was fatigue and headache, way more than any other neurological issues. So the potential impact on emotional issues and cognition rather than seizures and ataxia is what we're up against in childhood. Let's talk about headaches a little more. In fact, there have been a good many studies of headaches, both in adults and in children. And if you look at the percent where it's present, it ranges from nothing to 47, from 8 to 37. The studies where it was not found, I have to believe they didn't look too hard. And there's a large study that was done in childhood which weights this number, where, again, I don't believe they look too hard. More commonly and consistently now, we're finding numbers that are close to 40%, a lot of children. Now, agreement between what the parents report prior to coming to clinic and what occurs once they're face-to-face with us and being questioned is interesting. 28% who denied headaches in the preclinic survey actually reported them once we were sitting in front of them. And 20% of these children required medication. 6% actually needed to be referred to the headache center. Bottom line is, parents often don't relate headaches to celiac disease, and we must explicitly ask to get the information we need. Now, this study demonstrates that in the classical presentation of celiac disease, headaches is present, but it's in the atypical presentations in which you don't have prominent GI symptoms. And those are more and more frequent. A high proportion have headaches. And even in the asymptomatic child, say family member who is then found to have celiac disease, we then see that they too have substantial amounts of headache problems. Looked at the other way around, how often are headaches an index of celiac disease? Well, About 1% of our population has celiac disease, 2% of those with headaches. If it's migraine we're looking at, it jumps up to 6%. And this surely points to the fact that if we're dealing with headaches in pediatrics and we don't have a clear explanation, we are more and more obligated to think of celiac disease. We do know that far too many of our celiac patients are missed for too long. Now, the onset very frequently precedes the celiac diagnosis. The type of headache is an episodic tension type in the great majority, but others occur. And the frequency of the headache can be remarkably high. 46% were having headaches every other day. The risk factors, the older the child, the more likely they were to have the headaches. They were the ones who were subject to anxiety, depression, and behavior issues were more likely to have them. It's interesting that there is no association that we could define between headaches and attention deficit problems, although these were commonly found amongst our children. Fatigue is clearly a significant factor.
Low battery. Low battery.
Sorry.
Low battery.
Now, the effect of the gluten-free diet, as noted before, there is substantial improvement on the diet, but not universally. And it does relate to the type of headache. Chronic tension headaches appear to be less likely to improve and may well require referral. Now, when should we refer these children to a headache clinic? And we've defined these issues. If they continue to occur multiple times a week, if the severity reaches 10, so it's really bad. Obviously, if there's associated vomiting, sensory changes, focal weakness, imbalance, we need to worry about other causes of headache, because as noted previously, overlap can occur. If they're waking at night, and certainly if they're missing excessive amounts of school. There's more that needs to be done. We need to identify markers of the neurological problems. It's interesting that anti-tissue transglutaminase 6, rather than the one that we usually use to screen for celiac disease, which is 2 or 4, this might be a marker that we need to explore more carefully. We need to evaluate the neuropathology more closely. We need to establish the pathophysiology. Is it just hypoperfusion? Is it perivascular inflammation? The micronutrients, maybe, though I need to point out that most children on a gluten-free diet fairly rapidly reverse the micronutrient deficiency other than for 25-hydroxyvitamin D and iron. And we also need more in-depth studies of non-celiac wheat gluten sensitivity. Now, there are many case reports of associations between occasional neurological conditions and celiac disease. These are rather rare, though, and we hardly see them, but they do occur. It's in the psychological realm that we obviously have more of a role to play in pediatric celiac disease. And our psychologist set out to ask just how common is the psychological problem? When does it intervene in the evolution of the disease? What impact does it have? And what should we be doing to support these families and children? Well, 50% at least have a psychological problem. I'm sorry, let me restate that. 50% have at least one psychological problem versus close to 18% in the general population. Depression, anxiety, anger, and distress are prominent features. In this published report, we see that compared to the general population, it's anxiety and ADHD that stand out as particularly relevant. A smattering of everything else occurs, but with a lot of overlap. with the normal population. Now, the gluten-free diet is very helpful, but it is a double-edged sword. On the diet, some things improve. The parental distress is overall better. The youth distress is better. Youth anger improves. Youth depression improves. Youth anxiety improves. It hasn't disappeared. But it's a double-edged sword, this diet. It puts a burden on the family and particularly the parent. And here we know it becomes harder to talk about your child's health. Others don't seem to understand, and we have a blight of gluten-free people who don't really require the gluten-free diet, and that fad has sort of devalued the child who reports that they want to be gluten-free at a party or some other social event. I feel isolated from others. That gets worse. I feel frustrated. That actually got worse. So help is needed. And this bar diagram demonstrates that it's needed at any time we're encountering the disease in our clinic, whether it's in the newly diagnosed or those who've been diagnosed over a considerable period of time. Those requiring assistance, those requiring referral, were no different in terms of numbers, independent of when diagnosed, which surprised us. We have evolved a means of rapidly screening. It's the 2 15-minute pieces here. The one does a specific interview asking questions like, what is it like to be gluten-free, etc. And the other is a standard mental status examination. But it doesn't take an awful lot of time in the hands of an expert to relate what's going on and to be in a position to offer help. In summary, the psychologist identified significant symptoms and referred up to 50% of the children for additional care. No significant differences by the time since celiac disease was diagnosed. During the psychology consultation, families discussed emotional adjustment, impact on life and physical well-being, and the management of the gluten-free diet. Parents reported high levels of satisfaction with those visits, and the multidisciplinary approach is indeed a feasible model for specialized optimal treatment. Turning to the neuropsychologist then. As noted before, cognitive learning or attention problems are seen in a large percentage of the children coming to clinic, 48%. The neuropsychological goals were to try and find what was the cognitive diagnosis, how much was subjective, how much was objective in the learning pattern and attention problems, what school supports were in place, what further needs were there. Now, the cognitive diagnoses, ADHD is up there, learning disabilities, intellectual disability, really autism and speech problems. Now, notice these are defined problems and they weren't necessarily present at an organic level in a large number of these children. But academic problems were considerable. And probably as a result of attention, fatigue, and headache, which would influence attendance, writing, work completion, work submission, reading, and math. If you looked at the accommodations that these children were given at school, it's interesting to note that at the time they entered the clinic, a large number had not yet received any accommodations. IEPs, 504 plans, informal arrangements, none yet in progress, there were some. Now, what were the qualifying conditions? Notice that celiac disease is included, but not in all. ADHD, mental health, and other medical problems, what prompted the accommodation. And we would think that all of these children with celiac disease are deserving of accommodation, certainly if they are to abide by the gluten-free diet. school accommodations, the correspondence between pre-clinic surveys and in-person interviews is interesting. 20% said no on the surveys, and yet they said yes when they were interviewed. So they basically were not relating the accommodation to celiac disease in many cases. Parents may not report non-celiac school issues unless explicitly asked, yet these can influence the management of the disease and need to be explored. All right. Now, at this stage, we've also been able to look at the effect of behavior assessed in standard techniques and executive functioning. And as you would believe, behavior and executive function would influence cognitive ability, and indeed they do. Not surprisingly, then, that we have to take care of these and maybe add to our intervention beyond the gluten-free diet, things like cognitive behavioral therapy in order to get an optimal result. More recently, we've also looked at child behavior and executive function and the influence of this on compliance with the gluten-free diet. Now, we know that these two elements influence compliance with things like diabetes, so it's not surprising that we're finding, and we are, that they're really important in maintaining and understanding who actually abides by the diet. It's of note, and this is something I've noted over the years, that young children very frequently do very well in this regard. They're frequently telling their parents what to do and what's not good for them and what's not bad for them. But as the child enters the later times in life, what I call the beer and pizza time in life, things change, temptation increases, behavior actually deteriorates, with resulting non-compliance. So there is much in life more important than beer and pizza for these young children, and therefore maybe that's why they're doing well. Thank you.
Thank you, Dr. Kersner. That was a great talk. It was great to hear the perspective from pediatrics and also the perspective from having a really unique celiac program that had neurologists and neuropsychologists embedded. So we'll go back to questions and answers now. I think we have 10 or 15 minutes that we can devote to these. I want to go back to Dr. Frank for a minute and ask a very good question that several of you asked, which is there a difference in the response to a gluten-free diet in terms of the neurological manifestations, depending on the age of the patient? So if you've had untreated celiac disease for a long time, are you still as likely to have your neurological symptoms improve?
I don't think that we have followed people long enough to really be able to answer this question. Let me start off with that. However, in my experience, when I have seen people with celiac disease that gets diagnosed later in life, when they go on a gluten-free diet, they certainly have those manifestations improve. So I think at any age, no matter when you get diagnosed, going on a gluten-free diet can improve your symptoms.
Great, thanks. I'm going to ask the next question of Dr. Kersner. A number of people were interested in knowing the time frame for improvement of anxiety that could be related to underlying celiac disease. So how long does it take after they're on a gluten-free diet for those patients who have anxiety that's going to improve to improve?
Sadly, I can't give you the answer. I can give you my impression, but what's missing from a lot of this is longitudinal information. We don't have systematic reevaluation of anxiety over time. We're happy to have had an evaluation of anxiety at the time of entry. And when we compared the time of entry of people coming into clinic who'd been diagnosed over, some years ago, as compared to children who came into the clinic more recently, surprisingly, there was not much difference. Now, why? Was this a reflection of the fact that those with anxiety ultimately came to the clinic to get specialized care? Or was that a failure of the gluten-free diet over extended time? And if you look around the country at return rates to celiac clinics, follow-up visits, it's remarkably poor. And I was impressed when I started in the clinic to realize that people coming back very frequently were returning because of the emotional issues that accompanied the disease rather than the gastrointestinal issues that I was trained to treat. So I think we need the answer to that, but quite honestly, I can't give it to you.
I have a couple of follow-up questions for you. Actually, they're not truly related to that question, but in terms of neuropsychological problems, have you seen any children with celiac disease who had coexisting obsessive compulsive disorder? And could that be related to celiac disease?
I offhand, the answer is I don't think so. We've seen, as you saw, a lot of attention deficit problems, but obsessive compulsive behavior, particularly, I am impressed by the fact, anecdotally, that hyper anxiety around the diet can be very real. Is that something that only occurs in an obsessive compulsive child? Or is that something as a product of, induced fear? But it's a very real phenomenon for us. We have become impressed that fear of contamination, fear of, a gluten intake, that it can be excessive and can do as much harm as continued non-compliance. But beyond that, I'm not able to tell you if it relates to an underlying obsessive compulsive personality.
Can I ask a follow-up question related to that? We know that obsessive compulsive disorder is actually on a spectrum of anxiety disorders.
Right.
So if someone already has obsessive compulsive disorder, I can imagine that additional anxiety may exacerbate that obsessive compulsive disorder, certainly. I also think that there are different types of anxiety, and this is just my observation, but food insecurity, as you were getting at, can certainly be a part of it, and perhaps food hoarding and hoarding behaviors, which we've seen in some people, might be under the obsessive compulsive umbrella as well. So I think when we think about obsessive compulsive disorder, do you think that perhaps there's a larger umbrella that either is meet criteria for obsessive compulsive disorder, or that existing may be exacerbated by anxiety and environmental factors?
Great, thank you. Back to Dr. Kersner. You missed, when you were restarting your Zoom, our questions on brain fog, but I wanted to ask one of you.
Yes.
How should newly diagnosed children with celiac disease and brain fog present that to the people at their schools?
Wow, that's a great question. I think the need to get a 504 plan and the need for an advocate at the school to actually explain the content of the disease is great. Vanessa has done a terrific job of making available education materials to school pretty well across the country. And we have actually had one of our education specialists frequently go into the school to discuss with the family and with the school themselves the accommodations that are necessary. Now, I'm not sure if that entirely answers your question, but I think you need appropriate education of the parent and of the school, and if necessary, an advocate who can go to the school if we're getting resistance to the accommodations that they require, and an understanding that it takes time to clear, but that it should clear and that the child should be understood within the context of that possibility.
Great, thank you. Back to Dr. Frank. There are a couple questions about neuropathy. One of them is, does numbness and tingling in your arms and legs always mean that you have neuropathy?
No, numbness and tingling in your arms and legs can be from a lot of different reasons. It's one of the more common reasons that people go and seek an opinion from a neurologist, and it's not neuropathy, and it doesn't necessarily even need to be related to celiac disease. There are many causes for that, which I'm not going to get into on this webinar, but no, it doesn't mean it's neuropathy. If it's persistent, if it's just in your legs, that's most consistent with neuropathy, but even that doesn't mean that it definitely is. And but especially if it comes and goes, that's less likely to be neuropathy.
And could you again comment on how often neuropathy associated with celiac disease is reversible?
You know, we look at all the incidence and how often we find neuropathy in how often we find celiac disease in a neuropathy clinic, how often we find neuropathy in celiac disease, but how much of it is reversible, I think it hasn't been as well studied, especially because it can take a very long time to reverse. If there's severe damage of nerves, if you cut a nerve in your arm or your leg, it will regrow, but nerves regrow about 1 inch a month. And so you can imagine if there is severe damage to nerves in your feet and legs, and that it's a foot of nerve, it can take a long time for that to regrow and to heal. So it depends on the severity of the irritation or the damage of the nerve. If it's simply irritation, it could be very quick, within weeks or months. If it's severe, it could be years.
Thank you. Another question about seizures. So if you have a seizure disorder that's been linked to celiac disease, you're generally compliant on a gluten-free diet, but have a stray on an occasion. Could you precipitate having a seizure by a large gluten ingestion?
Well, I wouldn't recommend a large gluten ingestion. Let me start off with that. For any complication related to celiac disease. I think that gets at a question that I don't know the answer, but maybe the two of you do, and that is if there is an inflammatory response with a single exposure to gluten, that may trigger other paroxysmal or intermittent or triggered events, including something like a seizure. So maybe the two of you could answer the broader question: is a single gluten exposure, does that raise your inflammatory markers?
You know, the one thing I would add to this, we talk about a celiac crisis, and occasionally we see someone who, you know, by mistake has a massive intake of gluten, and very soon after they've gone on a gluten-free diet or something. And I can well imagine in that situation, you have a catastrophic response, and there are many factors that could precipitate a seizure. It's hard for me to imagine that small amounts of gluten would do it, and I would be very cautious about inculcating that idea, because hypervigilance is something we've become extremely concerned about. And I think there is fertile ground here to heighten the anxiety disproportionate to the threat.
Yeah, but that raises a good point. If there's inadvertent gluten exposure and someone is up all night because of vomiting and diarrhea, for example, that may trigger other issues related to seizures. So I hear what you're saying on that single exposure.
Here's another question actually for both of you. How does one find a doctor who's knowledgeable about both celiac disease and neurological conditions? So everybody might live near a major medical center in Boston or in Washington, D.C. So how do you find those doctors?
There's a long silence here.
Well, I wish there was an easy answer. I think that really seeking out medical practices or hospitals that have a strong neurology department and a strong celiac disease center are more likely to have both physicians that are familiar with the interactions. I don't think that there's a registry, but perhaps there should be.
Yeah, certainly, I think for pediatrics, the best I could suggest is be in touch with a major center and ask them. We certainly know of physicians in our area who are particularly adept at, quarterbacking, I'll call it that, and can adjust to this requirement. But the fact of the matter is, the average practitioner really needs education still about the relationship between neurology and celiac disease, and having experts who are currently, involved in that dimension is probably a rarity.
Yeah, and I think everyone who's watching this webinar likely needs to be their own advocate and to have education, and that's why they're watching this webinar. I think there's still, unfortunately, a myth that celiac disease is not as common as it is, that it's a rare disease. It's not. So people impacted by celiac disease need to be their advocate in many situations.
I think we have time for one more question that I'm going to sneak in, and this is for Dr. Frank. You listed conditions that are frequently associated with celiac disease, and I also had a list of things where there's not much evidence, but there are 3 disorders that have come up multiple times on the questions that I wanted to ask you about. They are multiple sclerosis, fibromyalgia, and complex regional pain disorder.
So I'm not going to really address fibromyalgia and complex regional pain syndrome because I think that those are both very common. I think fibromyalgia, we are finding out, is actually more of a sleep disorder. I think we've all had that experience when we haven't slept well and we're sore the next day. It's my understanding that that's the experience that a lot of people with fibromyalgia have. I don't know that there's a clear link between celiac disease and fibromyalgia. And complex regional pain syndrome is really more of a focal neuropathy rather than one that we think about related to any type of malabsorption or systemic issue. It's really an excessive response to some type of trauma in the area. Multiple sclerosis comes up all the time when it comes to celiac disease because multiple sclerosis is an autoimmune disease that impacts the brain and spinal cord. And there have been multiple studies looking at the association between multiple autoimmune disorders. MS is behind a barrier and somehow is not usually linked to other autoimmune diseases. We frequently look for other autoimmune diseases in the context of celiac disease, whether it is thyroid disease or diabetes, but those links don't exist when it comes to MS. So we really don't think there's a link between celiac disease and MS.
Thank you for that answer. And I'd like to thank our speakers for 2 superb talks and also for very thoughtful answers to the many questions we were able to get through. And again, my thanks to Lee and NCA and all the other individuals from our Harvard celiac programs who've contributed to this and have been mentioned. So with that, I'll turn it back over to Lee.
Thank you. I appreciate that. I'm just blown away by all the information these gentlemen have shared right now. I hope you found it informative. I hope you found it useful. It certainly blew me away. So thank you so much. As we mentioned before, a recording of today's webinar will be on our NCA website probably sometime next week. Meanwhile, stay tuned for our next program, which is on October 27th. It's called Dermatology and Celiac Disease. Did gluten cause this rash? Panelists will include Dr. Shadi Kurash, dermatologist at Massachusetts General Hospital, Dr. Sophia Delano, dermatologist at Boston Children's Hospital, and Dr. Chani Silence, a research fellow at Massachusetts General Hospital under the mentorship of Dr. Kurash. You can check the NCA website for all these webinars or sign up for our newsletter to get the latest webinar schedule as soon as it is available. Until then, stay well and have a happy and healthy fall. Goodbye.